The CDC estimates that 1 out of 5 U.S. adults suffer from chronic pain. Suparna Damany, a physical therapist for 20 years, is attacking the pain problem with a different approach right here in the Allentown area. The Damany Integrated Approach.
I think I'm going for resolution. I'm not going for management.
Damany brings the best of both worlds. She completed her bachelor's degree in physical therapy from the University of Mumbai and master's degree from Temple University in Philadelphia.
I think what sets me apart is my holistic style of thinking. And I like to connect the dots between the symptoms to actually get to the cause. So I think what's really different about my program is that firstly, it's causative, it's not symptomatic. I look at the symptoms, but I try to find the cause and I try to treat the cause. Secondly, it's integrative. I integrate the whole body when I'm treating and when I'm even developing a plan. Thirdly, it's dynamic, so it changes because the body changes with the treatment, and then the treatment needs to change also because otherwise you hit a plateau. I'm going for long-term fixes. I'm not going for short-term fixes or quick fixes. So there are many different aspects of pain. I think it's really hard to simplify pain in that sense. It's complex. I don't think it's complicated, but it's complex because there are a lot of factors that go into it. And giving opioids or medication is only masking the pain.
A study published last year in the Journal of the American Medical Association found that opioids weren't more effective than non-opioid treatments in chronic pain patients.
I think that medication should be used if they're effective, but they should be used with an end goal in mind. I think that there's a place for both. And in fact, I think they work beautifully together. And that's the beauty of being able to combine the Eastern and the Western approaches. You take the best of both and meld them.
And at her practice, the Damany Center for Chronic Pain and Holistic Wellbeing on Hamilton Boulevard in Lower Macungie, you can experience some of these ancient Indian approaches.
These are ancient techniques that have been tried and tested and true.
Like the wet spa.
We start off with the scrub, dip it in oil and do a particular type of massage. And then we use the oil to do a massage for the whole body. We focus on the areas that may be tighter or may have more pain, but basically it's a full body massage. And then after that, we move the Vichy shower over and we put jets of hot water on the patient. And so there are 5 jets here plus a handheld. Again, that helps to soak the oils into the body, but also we use the handheld and these jets to focus on any area that may be painful. My patients with fibromyalgia respond beautifully to that because it really helps the inflammation. It's relaxing. The hot water feels really great, and the oils, as they add up, as the benefit of the oils adds up, it really helps the mobility and the pain level.
You can even stop by the Ayurvedic juice bar and try the smoothie of the day, like this one, that's filled with antioxidants and anti-inflammatory ingredients.
Ayurvedic medicine originated in India over 3,000 years ago and relies on lifestyle changes and natural treatments. This system of medicine stresses the connection between the mind and body.
What India taught me was that textbook approaches are very rare, and textbook cases are very rare. And so you need to think outside the box.
And Damany found this to be true with the case of carpal tunnel syndrome, a common diagnosis in the late 90s among people working in front of computers.
These patients, these people who were working on the computers day in and day out, were getting hurt. And the most popular diagnosis at that time was carpal tunnel syndrome because they would get pain in their hands or numbness in their hands. And as I started treating, I realized that really they really are not suffering from carpal tunnel syndrome, and they were often having failed surgeries. So I started seeing that I was actually treating more failed surgeries from carpal tunnel syndrome than I was treating true carpal tunnel syndromes.
Damany wrote a book in 2001 titled It's Not Carpal Tunnel Syndrome, based off this experience.
I realized that it was a syndrome that was more of a neck-arm syndrome, and it was much more widespread than just the hands. And a lot of the symptoms were coming from either the neck or the upper back or maybe even the chest area from from tightness and postural problems because of sitting at the computer and doing static, repetitive work, which our bodies are not built for.
And today, Damany has a solution for people working your 9-to-5 desk job. Stretch a Clock. It's an app you download. You pick which parts of your body you want to work out. Then you set an alarm which will go off, and once the alarm goes off, you can follow simple video exercises right at your desk. Damany says her treatment approach is for
anyone who has any kind of pain, dysfunction, postural issues, nerve issues, and anyone who wants to stay healthy and prevent injury.
Damany was a presenter at last week's TEDx Lehigh River. If you're interested in trying her integrated approach, you can visit her website, damanyhealth.com, for more information on her clinic. Damany is working on a couple of projects now, a new book on chronic pain called Chronic Pain Connecting the Dots, and a treatment manual so that other therapists can learn her techniques.
I consider myself very, very blessed that I am able to help so many people. But I feel like I need to take it to the next level now. And I want to take it to the point where people are more aware of this and can start preventing it.
In Lower Macungie Township, I'm Karishma Desai, PBS 39 News Tonight.